As we end the summer, maybe get into the school year, keeping in mind dental health, and that means taking plenty of precautionary measures and implementing some preventative care into our regimen. Here with more tips on what we can do, a couple dietary options too, which I didn't know about. It's going to be fascinating to hear from Dr. Kenneth Armstrong on that. It's good to have you.
Thank you, Adam.
You're an Albuquerque dentist.
I am an Albuquerque dentist.
Tell me about we were discussing this during the break, the best routine for taking care of your teeth. What do you want to hear about?
Well, let's start off with a toothbrush.
Yes.
Toothbrush, brushing for 2 minutes, twice a day, and flossing. That's basics.
How many people do that?
Oh, a few.
I mean, in your practice, you probably see all kinds.
Newscasters, dentists, some people like that.
People who want to keep their teeth.
There are a number of people that do it. Some people are pretty good at doing that.
What are the most common and avoidable dental issues?
Well, dental decay. It's worldwide. I've seen patients in Africa, the Philippines, India. Dental decay is all over the world. And they get it from toddlers with the teeth to seniors in nursing homes.
Is it really as simple as sticking to a routine, though, to ward that off?
That helps a lot. There are a few things you can do. Brushing and flossing is a good start. The xylitol product, which I'll mention here, is also excellent. And fluoride rinses. If you do that, you're going to really protect your teeth really well. Yeah,
that makes sense. It's something that you want to try to incorporate in your day. And you say twice a day, right?
Well, they recommend twice a day for 2 minutes. That's longer than you think. I brush for 2 minutes at a time. I said, I'm getting tired.
Yeah, I bet people probably don't go the full 2 minutes most of the time.
They probably don't, but it's a good goal to set.
Yeah, sure, absolutely. Okay, now you mentioned xylitol, and these are some of the products that you're talking about. Why and how do you implement something like that into your diet? Why is this going to be beneficial? Well,
xylitol is coming on the market now. It's a 5-carbon sugar alcohol. That explains a lot to you, doesn't it? But here's a sugar that prevents decay. What it does do is it knocks out the Streptococcus mutans, which is one of the big culprits in causing dental decay. It also makes the plaque much more slippery and falls off. Your teeth feel much smoother with it. So this is one of the really good. What I do is I keep, it comes as a gum, comes as a little mint, or you can buy it as little packets of sugar that you can put over in your coffee or your water. And I keep it in my car, and after I brush and floss in the morning, take the fluoride rinse, on the way to work in the morning, I'll put a xylitol in my mouth. Dissolves in about 5 minutes.
It seems really simple. Is it effective? Have there been enough studies done on this to prove that?
You know what? Everything is controversial.
Yeah.
Everything is controversial. But, you know, I was in Africa just recently, and I saw 30% of the patients there did not have any observable decay in their mouth. They could use a good cleaning, but they didn't have decay. It's a bacterial disease too. You have to have the right bacteria in your mouth that causes it, that produces the acid that produces the holes in the teeth. You don't have that. And here's what this does too. Mothers, if they take it with their children, the vertical transmission is stopped. So the mother gets the good bacteria in her mouth. When she kisses her child, the bacteria is transferred across. She puts a spoon in her mouth, puts it in her child's mouth. The vertical transmission of the bacteria from mom is passed over. So I tell the mothers who are going to have children, start taking it. Get your mouth healthy, and your children will enjoy better health too.
It's fascinating. What are other dietary options that people have out there that might be with your mouth, right?
Right. Yeah. Not sipping carbonated drinks all day long. I mean, I'll drink a Coke every now and then, but if you're constantly sipping that, you're keeping your mouth more acidic. One of the things too about the xylitol is it helps to make your mouth more alkaline, which actually helps prevent dental decay too.
Very, very interesting. Okay, well, so sticking to a routine, you recommend that. Where can people get more information on all the things you talked about today?
They can go on the internet. You can buy it on the internet. You can buy this stuff at various places in town, in Vitamin Cottage and places like that. Stick to 100% xylitol. I like it.
Okay.
Sometimes they mix it with sorbitol, other things, which can mess it up a little bit.
All right, KRQE.com is a good place to get it information. Dr. Armstrong, thanks so much.
Thanks, Adam.
That's good to have you. We'll be right back.